Today marks World Cancer Day, and February is also National Cancer Prevention Month. It's an opportunity to bring awareness to the disease and help educate the public and fight for survivors past and present.
Here to talk all about it is Dr. Jahangir with OptumCare Cancer Care. Good morning, doctor. Welcome in.
Good morning. Hey, thank you for having me here today.
Thank you for joining us.
Good to have you. What is World Cancer Day all about?
Well, it's all about talking and discussing prevention of malignancy, number one. Number two, how we have evolved in terms of chemotherapeutic interventions and therapies regarding malignancies. And lastly, probably discuss the challenges that we face on day-to-day life in the world of malignancy. Unfortunately, despite our best efforts, cancer continues to be a global health issue. Yep. In U.S. alone, we're expected almost 1.7 million new cases this year, which is approximately 5,000 new cases a day. And that is an astonishing number.
That's astonishing to think about.
Yeah, and it's a constant reminder that we need to do more. We need more efforts. We need more novel therapies. We need more clinical trials to combat this, this devastating disease process.
To bring it back local, what is OptumCare Cancer Care doing here in Las Vegas then to help address this?
Well, if you look at cancer patients, they're fighting a battle on many fronts, right? Oh, yeah. They have physical debility. They're emotionally depleted. It's a financial burden. It is it affects their family and life, and friends. So the mind and the body and the soul and the community has to come together to produce the best outcome in terms of treatments. And we acknowledge that at OptumCare. And we wanted to create an environment where we are able to provide healthcare in this holistic fashion. So, as a result, we have a 55,000 square foot facility in the heart of Las Vegas, where patients not only have access to their oncology care, but also state-of-the-art chemo infusion center and access to surgical oncology, a very robust breast care center, on-site radiology, including PET scans, CAT scans, chemo port placements, PICC line placements. We have 2 endoscopy suites. On a supportive care aspect, we have genetic counselor, we have case management, we have for patients, family and friends, lounges and a cafeteria. I mean, it's an all-round, well-rounded, patient-centric facility, and we're really, really proud of it.
Yeah, I can personally relate to how important it is, that facility, when you have a loved one who's diagnosed. My dad was diagnosed with leukemia.
I'm sorry to hear that.
Thank you. There was just, there was a very, very short time period, like a matter of days, where we decided what city and what facility that he would be treated at. And then when we did decide, that facility became literally our home.
Basically home.
Right, our second home for sure for the next 9 months. So it's it's when you say patient-centered and family-centered, there's a lot behind that comment.
There's a lot behind that comment. I totally agree with you. It is a devastating disease process. It affects the whole community. And our intent is that we want almost all the services to be in one concise place. So it's one-stop shop for the patient, and they don't have to run around the town for healthcare. And that's our mission.
And with that state-of-the-art facility, there's also convenient care locations across the valley too, just in different areas of town, depending on where you may be at. But from those renderings and those pictures that we saw, it looks like a gorgeous place. And on your point, it looks like, because you do call it home for such a long time.
Yeah. Boy, you're not kidding. You mentioned a breast center as well. So can people, obviously early detection is such a part of the cancer conversation. Is this a place where people can come to get their mammograms and get tested? Or?
Absolutely. So right now we've only opened phase 1 of the facility, which is medical oncology and chemo infusion. in later stages, we will open our radiology suites and we will open the breast care center.
Excellent.
Which is going to be involved in, of course, detection and treatment. I really want to make one point, which is, you know, in this day and age, the biggest challenge that we face is the fact that we have an aging population, right? So the geriatric population and the oldest old, which is 85 and higher, is on the rise. The incidence of malignancy is highest in this population group, and yet they are the least represented on clinical trials. So,
oh, interesting.
yeah. And a lot of the times what ends up happening is that these patients are either undertreated or not treated at all, which is a shame. And therefore, it is imperative for us to use this platform, discussions like this, to get one point across, that age is just a number. And what really matters is that how strong you are at that age, that directs your therapy.
Interesting.
That is paramount.
And there's more to come. Only phase 1. So
Absolutely, more to come, phase 1.
Well, doctor, thank you so much for
Great to
joining
have
us.
you, doctor.
Thank you
Very
very
nice
much.
to meet you.
Thank
Very nice to
Thank
meet
you.
you.
Thank you.
OptumCare Cancer Care is raising the bar in the fight against cancer. Their new 55,000 square foot cancer center is located on West Charleston at Rancho. Website and phone number right there on your screen for more info. OptumCare Cancer Care, proud sponsor of the Morning Blend.